name is Brian, and Brian Crater, and thank you all for being here. I just kind of want to be respectful of your time because we kind of click away. We might have a couple more joining us. If they do, it will be a very welcoming crew. But thank you for being to the inaugural launch of our Gold Ribbon Accreditation Program, kind of the camp orientation. So what I just wanted to do is, as you can see, we're kind of using this GoToMeeting platform to kind of go through, for those of you that are able to, is to go through. We actually have slides that we'll kind of go through, talk a little bit about what Gold Ribbon is, what you can expect, and what the next steps are, as well as take a look at a couple of the standards just to kind of look at those and how those might apply. So that's kind of the plan for this morning. As you can tell, we all can have audio capability. I know that lots of times with these calls, it's kind of hard to kind of get in. So I'll try to pause as much as possible just to see if there are questions before we kind of move on. But please be bold, be there. This is an interactive kind of experience to kind of help support all of you as you go through this process. I knew I could get on this technology wagon. So once again, yeah, thanks so much, and for kind of joining with us as I walk through. I wanted to start off just by making sure we're kind of all on the same page and have the same kind of lens as we take a look at this Gold Ribbon Accreditation Program. So what I just wanted to do is have a couple of background slides from information. So as you can see from this one, the point of Gold Ribbon, or let me even back up, is for those of you that may or may not know, COCA-I has launched this accreditation program. By that I mean it's a third-party verification that people are meeting foundational practices. Has been an effort of COCA. We've been doing this now for about 3 or 4 years, developing this program that has launched from what has been a self-assessment program, which the guidelines have been pretty much there because we had a lot of camps that were a part of COCA that said, hey, how do we know what may be the best, are the best practices with regards to medical, psychosocial practices in a camp modality. So we've taken that self-assessment and we've kind of launched into this accreditation program. And the goals really for this accreditation program, once again, is the kind of thing to advance and promote our foundational practices. I put in foundational practices, and I apologize, my lips might go back and forth from best practices to foundational practices. This is because I'm trying to be a good student. I believe these are foundational practices, and to illustrate the difference, foundational practices are really kind of that foundation. You can definitely, and the expectation is that many camps, and I think our observation is that many camps actually even go beyond these practices that work best for them and really become a best practice for their camp. But as COCA, we wanted to set down what are those foundational pieces that at least each camp should be looking at in developing their procedures and their practices. The other is also from the accreditation programs to provide a resource for our camps in the areas of facility operations, programmability, healthcare, and psychosocial. I share that in that you will see that most of the standards that we're looking at deal with the medical and psychosocial, even though there is attention to asking camp operators to take a look at their facilities and their operation based on those foundational practices of others. And that can be other camp associations or in some situations, it's state regulations, those kinds of things. So once again, we're trying to put that all together. The other thing that we wanted to do with this program is to provide a recognition for our COCA camp members that with regards to the practice of these industry standards, that once again, you as camp operators can share with your donors, with healthcare partners, and also as COCA, that we also have plans to be able to share this with certain kind of industries. I take a look at the Children's Oncology Group in the United States, or we take a look at the, I want to say it's A16, and I apologize, that is the Canadian kind of equivalent of oncology practice and healthcare practice in Canada. so that we can let these folks know that really that these camps are the ones that are meeting these foundational practices. So that's kind of our goals for the program overall. Highlight this once again is that we see this as an educational program to help COCA members and organizations once again to identify those vital practices specific to their settings and population. And let me take a pause right here, because I think this is one of the important things about this program, is that we didn't want to create foundational practices that just everybody used, but we wanted to at least list those areas and ask camps, each individual operation, to take a look at how they practice those that's specific to where they're holding their camp session. If that's a day camp, if that's a day camp in the city, if it's a residential camp that may be farther away from a support center, that what those actual practices and procedures might be different, and we need to allow for that. But with that is we ask you as camp operators to really consider that what is really going to be the best practice in this area, or best procedure in this area for our camp, for the population that we're working with and in the setting. Because once again, it's different if it's family camp, youth camp, and those kinds of things. So that's an important part of this. And the other piece is that we wanted to make sure that with the accreditation program that these practices or policies are either documented or delivered, or both, that they're documented and that we're delivering what we document with regards to procedures. And so that's really kind of the crux of that. Questions about that? So here's what the standards are then, and moving forward is we've identified areas of practice, and what we're really trying to do with this is to ensure that our programs are safe for those that we serve, and that it's verified by an objective third party. That's what makes it an accreditation program versus just a self-assessment, is that you really have somebody else come in and say, yep, you're doing what you're doing, and doing it well. And that way it gives some credibility, not only for your camp to know that somebody that's unrelated to your camp is coming to look at that, but also to the partners that we work with. The other thing with regards to these standards is just to let you know that we're really have started with these in the context of overnight camp programs and day camps. We know that many of our COCA members have other kinds of programs, single day, hospital-based programs, single event kind of things. And those are all valid and those are important services. But for the point of this accreditation process, we're really just taking a look at day camp and overnight camp programs. We haven't ventured into the others. So when you're taking a look at standards, you're taking a look at compliance, once again, please try to keep that lens with regards to your overnight program or day camp program. What they are not, I said this a little bit earlier, but these standards that we're looking at, they're not a how-to documents. They're really just guidelines to help you develop your own that are specific for you. They're not a prescriptive practice. And also the accreditation of these visits isn't a inspection or a chance for us to try to judge your practices. It's just to verify, to observe and to verify. And it's also, when I go back to the first slide talking about how it's an educational program. So we're also trying to help our camps do better jobs as we go through. Questions about just kind of the history before I go into preparing for a visit and what's going on with the visit? Any questions about the intent?
No.
Am I doing okay?
Yes.
Okay. Cool. Thanks for the feedback. I appreciate it.
You're welcome.
I think that was Sandy there. And I appreciate
yes. Yeah. You don't want silence.
It's going good. It's going good.
Okay. I have to check my technology to make sure everybody's still here, not asleep. So let's take a look at preparing for the visit, because that's why we're here. And by the way, thanks to all of you for stepping forward. I have to say that that you should all be proud, because not only you're going into new territory and you're helping us as an association take a look at this accreditation by going through it for the first time. We'll learn from you. And I appreciate allowing us to do that. I think there's also a certain place of, I really respect your programs for kind of taking a step forward as we first go out and do this. So pat on the back for each one of you starting off. With regards to preparing for your visit, so the best thing is, and we just talked about this for those of you that were on earlier, is that we're working off of the COCA accreditation guidelines. That's a version that says November 2007 down below. We should have been emailed those. If you haven't, someone in your at your camp, because I know there's multiple people from camps, they have gotten those. So you just might want to kind of share those going through. And those are the ones that I'm going to be referring to. We're working, I know Don and I talked recently that we're also working just to make sure that we can get these resources a little bit more accessible onto the website and right up in front for everybody. But I just wanted to make sure that you had that. The next part for actually preparing for your visit is, in our minds, is to collect supporting documentation. So besides reviewing those guidelines and seeing how they fit in your camp, probably the biggest task is going to be taking a look at what kind of documentation you have to support or you need to create in order to support your policies. And we'll talk a little bit about that. A lot of this you might already have in handbooks or procedure manuals or those kind of things, but once again, they may not be all in the same place. So taking some time to gather those is probably the lion's share of the work here. And so pulling all those together. The other thing is, as you go through the guidelines, as you take a look at the wording and guidelines, it's fairly intentional. And by that, I mean, we've had many meetings over a number of years, and we've done test visits to kind of test the application or the interpretation of these standards. So there's intention behind the way that they are written and the questions that they ask and what they're requesting. So as you go through, if something's not jiving with your terminology or maybe the way that you operate, or you just want kind of a further step besides taking a look at the standard, I would first say number one is take a look at the intent. There is an intent paragraph under each one. We'll take a look at that in a minute. But the other thing is seek clarification. Don't limit the contact with either your visitors or with COCA just for the day of the visit. At the end of the slideshow, you'll have my contact information, both email and phone. Please feel free to reach out to me. I'm more than happy to kind of talk those through to see what that clarification or documentation needs to be so you're comfortable. You know, use that resource. The other piece with this is we're asking camps to submit their documentation for review prior to the visit. The reason for this is we would like to make the visit more of an observation of practices in place rather than spending a lot of time with the paperwork, if we can do that ahead of time. So one of the things that we're working on is that COCA is looking at creating a portal for being able to have this documentation uploaded, to have your visitors actually review that or have a conversation with you, and for you to have a conversation with them as far as how it complies. And we are working on that. We do have what we would call Plan B in place. And we'll take a look at that in a minute as well, of where you can actually upload those documents so that your visitors and as assigned will then have rights just to look at those. So it's just between you and your visitors. So, but submitting that documentation up front is a fair amount of work, but I wanted, you know, it will help out on the day of the visit.
Brian, just a question, if I
Please.
may. So I have two documents in front of me, best practices, operation standards. One is dated May 2017, and the other is November 2017. Which one am I referring to?
Excellent question.
'Cause I think.
Could you take that May one and put it underneath your bird cage? Or, you know, to catch all those droppings, or you can put it through your shredder or that kind of thing. You know, we're working on November 2017.
Very good.
And I'm glad you asked that question, because just those dates demonstrate how we've been developing those over time. So thank you for the clarification of that we
You're
are
welcome.
on the November 2007. Excellent. Any other questions on that? Next is preparing for your visit. The other part of the actual visit is that Jennifer at the COCA office, that makes it sound like it's brick and mortar, but in our virtual office, our good friend Jennifer is the one that's kind of working at assigning our visitors both, and we'll talk about visitors in a minute, with your camps. As that communication goes, we just ask you to please be helpful in communicating with them, to have a call with them, confirming what date and time for the actual visit to take place. Hopefully there will be conversation ahead of time with regards to the documentation, but also our visitors are going to be coming from hither and yon. By that I mean they might be flying across the country, they might be local, it just depends. And so they might need some help and definition with regards to closest airports. Can the camp help out with transportation to the camp? If not, that's okay. They just need to know that. Do they need to? Some might need to come in the night before or stay the night after, depending on what their schedules are. So if you can just have conversations, just as we do in the camp community, take care of each other, that would be appreciated, because they're going to try to make those as soon as possible. And I think we're in that process right now. So I just ask you to be a good steward of your visitors and help them out with that. The link.
It's Deanna. I just have a quick question. I know that you had mentioned in the beginning that you're going to work on uploading this presentation to the website, but is it going to be sent out to all of us as well?
We will.
Okay.
That's a great idea, and yes, we'll make sure you get this. I think we're
Okay,
also. Go ahead.
No, I'm just writing frantically, and now I just decided to. So I just want to make sure.
Yeah, no, we'll get it to you for sure. I think there was also, and I don't know if it happened, but we're also trying to record. Yes, I see that the session is being recorded. So if you want to go back and visit that, you can. And really, it's for those that might not have been able to make this call. But so you'll have it in a couple different ways. Great question. Talking about the what you can actually expect as far as the length of the visit. Typically, our visits have been about 3 or 4 hours, and that means by our visitors coming to the site. And with that, what they're really looking to do is to tour your facilities, take a look at your activities. As I said, they're really coming in as a visitor, and they're so kind of showing them around. Are taking a look at your practices. And are you practicing what they've seen with regards to these standards and your policies? So, we ask that during that visit that you also please have whoever your camp healthcare provider is. It might be an RN, an MD, it varies, but that they also have availability during that visit to have conversations, because we want to learn how you do what you do, especially with regards to healthcare. Of course, we understand that there's typical kind of maybe medication delivery times, or there's, somebody that needs them a certain point. We get that, but if we can kind of schedule some availability with them, that makes the visit quite a bit easier. And then also part of the visit's a chance just to have discussion on relevant, on relevant comments that they have or questions. And this is also a chance to learn from each other, because we'll talk a little bit about visitors in a minute, but these visitors are healthcare providers that are familiar and participate in other camps, as well as other camp volunteers, seasoned volunteers, or camp professionals. So this is also kind of a collegial opportunity to learn from each other. And so that's kind of, we're trying to make that systemic and ingrained within the part of this program. With regards to after your visit, to kind of give you an idea of what would happen afterwards, is that after your visit happens, we ask our visitors to prepare a report of their visit. Your visitors are not one that determine whether or not if there's compliance and accreditation. They actually provide a report. So it's a summary of the documentation, what was complied, what maybe there are questions. There's a summary of observations from the day of the visit. And then all of those observations then go to a fall meeting of the Gold Ribbon Committee. And so the committee that will meet in the fall, that will review these visits. If there's additional clarification or information, and I don't know who victors are, it would be from visitors or camps as needed. And then then it's the Gold Ribbons Committee to make a recommendation for those camps to receive accreditation. My spell check was horrible on this, to the COCA Board of Directors. So once again, they're not the ones that make that determination. They are truly visitors, and it's the Gold Ribbon Committee that makes that determinative recommendation. Then what happens is it goes to the Board of Directors. Once they've made a decision, then we contact those camps with regards to their accreditation status. We also provide you with information that will be helpful for you to communicate this to your stakeholders. And then also there'll be recognition at the annual conference, as well as some publication of those accredited camps, as well as to other kinds of groups, as I mentioned, like COG and the Canadian equivalent. So that's kind of the flow of the accreditation process. I should have, and I won't, but I should put it in here, and I thought that I did. Let me talk a little bit about those visitors before we actually get into the accreditation standards. What you can expect as a visitor, for us, it's you'll have at least two. One will actually be, as I said, I think I mentioned, is either a camp professional or a long-term camp volunteer with an established program. The other is a healthcare professional associated with a camp. This year as well, there might be even 3 or 4. That's because we're training some new folks. So we're training some new healthcare professionals and maybe some new peer visitors. So they might actually come just to observe and be that. We don't want to overwhelm your program, but by having all these visitors, but it does help us to train. And so that's what you can kind of expect as far as the visiting group that's coming to you. If there's any questions about that process, I'd love to talk about that. If not, we'll just kind of go in and talk a little bit about the standards. We good?
Yes.
So the standards are actually divided into some general segments, and you can see that there's definitions, which can be helpful as you go through with these standards to kind of figure out, so what is a camp staff? What does that really mean? Who's a camp staff person and who's not? Those kind of definitions, so take a look at that. Then it gets into the actual standards. There's a general category, there's clinic affiliations, there's administration, staffing, healthcare, and psychosocial support. So that's the way it's kind of divided up, just so that you know. The other thing to take a look, and I mentioned this earlier on your different standards, is under each standard, there is a section that's an intent statement that tries to kind of explain what the purpose of that standard might be, and also what some areas that you might be want to look at in order to fulfill that, or in writing a statement or a policy or a procedure. And then there is an issue of compliance, and this is the one of saying that you'll see an icon on there that says written documentation. Now, not all, but I will say probably 95%, if maybe even not more of these standards, ask for some kind of written documentation. And like I said, that can be a policy, it can be a procedure, it can be something that you have that backs up exactly what you say, or what you practice. I should more articulately say. I think that with the documentation, this is the part that I just want to share with all of you from my experience with documentation, is that it's important to have as a legacy to move your camp forward. It's also an interesting thing that it also can be fluid, that it can change from year to year and be revised so that it helps with regards to giving a baseline for improvement. So having these documented can be helpful for your organization. The other piece to be aware of is that if you actually have it in writing, it's important that you practice it. And by that I mean is that if there was an incident that happened at a camp, and it happens every year at camps across the country, not necessarily COCA camps, but in camping in general, that there is incidents where there might be unfortunate situations where there's injury or there is a misunderstanding and those kind of things. And if there was the kind of thing where there was legal challenges to that, the one thing that lots of times they look at for camps is, do you have a policy in place? And if they do, the next thing they're going to ask is, are you actually following that? Because if you have a written policy in place, that's great. But if you haven't and then you're not following it, that's where the legal firm, and I'm not a lawyer, but that's where the legal work comes out and says that you're actually negligent, and that can be more. So as you write these documentations and these policies and procedures, please take a look at really writing what you can actually do, and what you can actually practice, and what you may, and keep extra attention, because that's going to be helpful for you, for your campers, number one, and number two, it's going to be helpful for you as an organization to make sure that that you have some integrity in what you do, and intentional forethought. So I just wanted to kind of share that off to the side. So let's jump in and take a look at a couple of standards. This is the first standard. It's also the one that actually covers a pretty big body of work, but the standard is 1.1, and it basically says, is the camp accredited by a recognized camp association or meet best practices established by a governmental body that's responsible for the oversight of all camp program operations. So the reason for this is because we know that as COCA, that we, as an organization, that our focus is really mostly on the medical and on the psychosocial kind of foundational practices, that and that there are others that do a better job at taking a look at how you actually operate your facilities. You know, by that I mean, are there regular safety checks there? If you provide food service, is that safe? If you have transportation, or if you have drop-offs of campers at your day camp, how does that work to make sure that everyone's safe? Are those that are working with the campers, do they have appropriate screening to make sure that we're limiting our exposure liability of having folks that are a part of our programs that don't have the best care and concern of our campers at heart? So all of these are kind of what I would call those operational camp operation practices. And those can go in two different ways. One has to do with programs, and one has to do with facilities. So really what we're taking a look at is, have they been a part of an accreditation process? And if you have, that's great. If, in other words, if it's American Camp Association, if it's the Ontario Camp Association, then you can just supply, hey, we have this, this is what we have. If you don't, then what is there? Is there an agency that takes a look at that? It might be the state that actually comes in and visits your facilities and says that your operations and what you're doing with regards to staffing and with regards to facilities meet those meet laws and meet what they consider best practices. So do you have those kind of inspections? And if you do, then once again, that can also be documentation that can provide that can support this kind of a standard. Questions about that? Another one that we take a look at lots of times in our history of looking at camps has to do with emergency medical planning. So this one, which is 5.3, says, does the camp have a medical emergency plan that takes into account, and I pause for intention, specific population served and the distance to support medical services? So really, this can vary as far as what the documentation is of what your plan is, of who you have on site, and what kind of emergency transportation arrangements you have. There are some of our COCA camps that actually have their camps on hospital campuses who are very nearby. There's other ones of our camps that might be a distance. And so with that distance, what is their arrangement if there is an emergency to get someone to the best center for the population they're serving? So if you have campers that have some acute needs, your emergency transport plan might be different than if you're doing a sibling experience or a sibling camp. It might be the same, but it might be different. If you have a family camp, it might be different, a session as well. So really it's asking you to take a look at your population and what the distance is to your support services. So what is that transportation plan? What kind of written and verbal agreements do you have with wherever you might take those individuals? Are there a way or where if you walk in with someone that might have sepsis and is an on treatment patient? Are they aware? Do they know that? Having a conversation ahead of time is considered a good foundational practice that says, hey, we'd like to use you as our support emergency center should something happen. And then once again, medical emergency that may occur during camp provided during transportation. And what that means is that your transportation plan might be, hey, we have a van. It's going to be quicker for us to put them in a van and take them to the emergency room. Well, what if something happens during that transportation? Have you thought about that? Once again, based on the population that you're serving. So this is an example of a standard that really you have to take into account your program and where you are. And hopefully as you take a look at your procedures that it reflects that. And these are some of the areas that we ask you to look at. Questions with regards to that? This is another one that I just wrote down, and we can kind of go through this because I think this standard takes a really good look at the intention and the compliance. So the standard is 5.9, and does your camp have procedures regarding to the collection, administration, and storage of camper and staff medications? Now understand that this has a couple different factors in it. It talks about collection, administration, storage, and it also talks about your campers, and it talks about staff medications. So you might, for us, lots of times we think all the time about our campers, but we might not be thinking about staff that are on medications. And they might also be under treatment, maybe for cancer. They might not be, and maybe have other kinds of medications that you need to be aware of as an operator while they're on your property and while they're going through this experience. And with regards to the safety of those medications as well as to the administration of those. So to kind of support this, what we did, and this is, I apologize, this might be a little small, but the intent gets pretty in depth. And that's why we suggest that you really take a look at the intent. But once again, with this intent, it has a couple of bullet points that the policy should include when, how, and where medications are collected. When do you get that information? When during the process? Is it during check-in that they do that? If you have someone that's coming to camp later than the regular check-in, what's that procedure for making sure that the medications are reviewed, that they're appropriate, that they're what you say you're going to have, those kind of things. Are they secure from being mistaken? And this is an issue that has happened in a lot of camps across the country, where if there are medications and they aren't secure, they might be either lost, or you might have someone that comes across them and not know what they are, or even there are youth that and there's evidence of this, of youth that have shared medications, like when they're driving back on the bus. Hey, I got this, you want one? We would hope that would never happen, but once again, what's our responsibility? And even if they're on a bus ride home, or if a bus ride to camp, that they're our responsibility at that point. So what's the procedures for that? Lots of times camps have a locked place to keep those. We've had the conversation for family camps. With families, you have the parents there. Is this something that we really want to lock or do? But what happens, once again, if those families misplace those, or if they share housing and camping, and we would hate to have under our responsibility that there be a mishap. And so what kind of things do you do for securing those medications, depending on the type of program that you have? The other one
Brian,
says, how does camp...
So sorry to interrupt, but what I note here on 5.9 is that you're not asking for written documentation. Was that intentional, or is this going to be verbalized by the camp director and the medical staff? How is that working? Because certainly I think that, I know our health department requires that this be documented, or they have documentation that indicates how we should be handling medication. How is that playing out through the gold ribbon program?
Yeah, for this, now once again, this is where I say from a foundational practice, it's not asking for documentation, but this is a conversation. It'll be going up, and
So it's
really this is where we want to have that conversation. How are you doing this?
Okay.
Now, mind you, if you do have documentation, that's amazing and wonderful.
Okay.
And a matter of fact, it would be something that, for instance, in other camps that I've gone to, they have documented that because it's a way to think through that process. But for this standard, it's an observation.
Okay. Thank you.
Also, because I think that observation might also have with, so where are the forms? How does that work? You know, it's kind of like, it would be hard to document a lot of that, but it would be better on site. So for instance, yeah, like even like one of the intent talks about how the camp meets their government or local treatment facility standards for controlled medications. Do you have controlled substances at camp? How does that work? Accuracy for medication distribution. That sometimes in a policy that's hard to describe, but once you're there and you're actually seeing how it works and it's secure and it's accurate is an easier thing to judge. Also how the camp handles staff and adult medications. Because once again, with adults and with staff, that sometimes can be done differently, but still it's important that there's some kind of practice just to make sure that access to those can't be misplaced or mistaken. And so how is that done? And then I think, Sandy, as you mentioned, the compliance is basically an explanation of the camper and staff medication storage and the administration process, and observing how those medications are distributed while they're there at camp. This is something that they actually want to see.
Okay, thank you.
Let's see. So those are the ones that I jumped through that I just kind of wanted to do for this orientation. There's many others that are in there. And this is where I go back to one of the beginning slides where it's, you know, if there is questions, like it came up here, you might, as you go through your documentation collection, or you're taking a look at how you comply with these, you have questions. If you do, here's my number, here's my email. Please do use me as a resource to be able to do that, because we want to kind of hear, I especially want to hear what those are to help us do a better job in helping to serve our camps, and also just to be able to share some of the intent as we kind of move forward.
Brian, it's Michelle.
Yeah, Michelle.
Can you address the following? If a camp does not have pre-existing written documentation, and they do follow some of the procedures, can they write up the procedures they follow and submit that as written documentation? Yeah,
great question. It's kind of the chicken before the egg. It's like, well, we didn't have a procedure when we started, but we're doing this. And yes, that's exactly, I think that's a great point, and that's completely the intent, is that if there is not written procedures on some of these topics, this is an opportunity where from COCA, from the point of view of being a foundational practice, it's important to document those so that you have those. And that can be just as simple as writing it all up. I will say, and so that's completely acceptable to do, and we would promote that. And this is also that educational process. It's like, oh yeah, and I've done this myself at my own camp. It's like, we really ought to have a written procedure for that. We practice it this way, but in order to make sure that we can evaluate its effectiveness, and also so that we can have consistency from year to year or from session to session, documentation can be a helpful tool. So that's definitely the intent. Yeah.
Great. Thanks.
I will also say, as a resource, and Jennifer helped me out with this, is I know that we've had a project with regards to Gold Ribbon to kind of collect some sample, what I would call procedures or policies. We have some of those. And I think that, and Jennifer, is it a place where we could actually provide them a link with the summary of this webinar, these slides and that kind of thing, also where those might be available, or where are we on that?
It's not real sophisticated at the moment. It's basically
in a Google Doc, and there are some examples for some of the standards that will take you to a link of one of our member camps that may have a written procedure for that particular standard. But I don't have examples for all the standards.
No,
And
but for the ones we do.
Yeah, for the ones we do. And if you want me to make that available, I can definitely do that and email y'all that Google Doc if you want to go in and just look at it. And I will say this, because I know a lot of you are ACA accredited, possibly if you have written procedures for some of those standards, I would love to maybe get a sample, a PDF, if you're willing to share your procedures with us. We can use them as an example. And I think it's important as these camps who are not even gold ribbon camps to be able to look at other camp programs and get ideas from their own examples.
Great. Yeah, and as we said, we're trying to build that. But yeah, Jennifer, when we send out to all the camps this year, if we could include that Google Doc and also that request, that would be awesome to help us build.
Yeah, that'd be helpful.
I'll do that.
Thanks.
One of the things that I want to do, and I once again, let me just ask if there's other questions that are out there or comments. I always like the poignant pause.
No, there are no.
But I also like to make that. I also like to open that door just because this kind of setting is important. The other thing is, Don, if maybe I could ask you to share, to take kind of control of the screen, and I wanted to share with at least you folks the kind of the work in progress that we're doing for uploading these your documents. And so Don, our executive director at COCA, has been working on this, and I'll let him just kind of basically walk through. We have the skeleton up, and it will be done here shortly. But with that, Don, I'll just let you share that, how we get them the information on this, what their visitor will look like, and the opportunity for them to upload that for share.
Sure, happy to, Brian. Can everybody see my screen?
Yes.
Yeah.
Okay. Right now, this is, as normal in any kind of software development, it always takes 5 times longer than you originally anticipate. But I'm going to walk you through something here just real quickly, and this is what we're calling the Gold Ribbon portal. The screen that you see here is located on and this will all be communicated to you in a document. But it's basically on a domain, a subdomain of the COCA.org website. This greeting screen here, as a matter of fact, when I just heard Brian talking about examples and definitions and things like this basic greeting screen here, we can put a lot of that information here, so you can go to one place to take a look at policy examples. You can take a look at, go to one place to get a copy of the most recent standards, updates, and things of that nature. So maybe we can make this a true portal for this whole Gold Ribbon program. As a camp, what this basically does is very much in process right now. It's got some basic functionality which we want to put in place for this year. So as a camp being visited, you will be assigned a username and password. All right. I think the day that I was doing this, I was in the mood for Italian food. So the username in this case is pasta. But at any rate, all you have to do is log in. Okay. You'll be greeted by the home screen. Use your username and password, like I say, that will be assigned to you. And all you have to do is log in at that point in time. Now, this is basically a very brief representation of the standards. And as you notice, this is broken down into the same sections that the standards are. You've got a general section, clinic affiliation, administration, staffing, and on. The whole point here is all this is meant to do is to provide an organized place by which a camp can respond to the upload the documentation requirements. So within each one of the standards, each of the standards will be listed. If we go over here to healthcare, you'll see there's a whole set of standards there. But the process is pretty much the same. There's a very brief summary of the standard itself. By no means is that meant to be comprehensive. What we anticipate is a camp undergoing this process, you probably want to have a printed copy of the standards and start matching up your policies with the documentation required. So basically, this is just a pointer, if you will. At any given time, if you're on the site and you want to take a look at the actual standard itself, you can do that. This basically will give you an uploaded standard. The camps are meant to really do one thing on this website. The camps being visited is to upload a file. Now you notice this blue section down here. That is for the quote unquote visitors reviewers. And what we will request from the camp is to obviously upload as many of the documents as you have. The visitors are charged with reviewing the documents prior to the camp visit. So in order to track the process, they can come in and take a look at your responses, make a note if the upload has been reviewed, if it's been accepted. We're asking for the reviewer's initials. Now over here, we have the show hide comments. The comments section are meant to be available both to the camp being visited as well as the reviewers themselves. So this is a place where a dialogue can occur and be recorded. So what you don't see here is some of the nicer parts of this. There's going to be down below here, you're going to see a save to database button as well as a submit button for each one of these. And the difference between those two buttons, save to database, is merely as you're going through this, you kind of save everything to the database occasionally so that you don't lose anything should something occur. A submit button can be submitted at any time, but the intention of a submit button is that at a place where you think appropriate, if you click the submit button, it will save all the information to the database, but also send out notification emails. So you can so that to say a reviewer, you go through, you fill out as much of this as possible, you click on the submit button, the two visitors, the reviewers, will receive an email saying, you know, the camp such and such updated their portal, you know, you may want to go in and take a look at this. So that's to sort of move that process forward. And really, this is where this whole thing is. Now, there's probably another 1 or 2 days worth of work here. So this is not fully functional at this point in time, but it's like I said, it's a matter that we will reach out to you in the next 2 or 3 days once it becomes live. But I guess in the meantime, that is a real quick overview. It's really quite simple. It's meant to be simple. It's meant to be user-friendly. So with that, I'll solicit questions or comments.
It looks really helpful.
Well, that's what it's meant to be. And we're trying to keep it simple. Trying to keep it real simple. So one comment I will make, in the upload file, we will make a notation here on the website. We're going to want to have those files uploaded in just a few relevant document types, meaning say a Word document, a PDF file, or something like that. Mm-hmm. Because as part of the functionality, when a reviewer comes in, there will be a link over here. Once a file is uploaded, there will be a link over here in that file link section. If they click on that, and it's a standard recognized file format, they can review your policy online without having to worry about downloading it or printing it or anything else. But in order to enable to do that, we just need to make sure that the uploaded files are in a set file extension basis so that the browsers can respond. and bring the file up for review. So.
Great.
Now, you know, I would also ask is on anything like this, my experience is, you know, you go through, you do your best shot the first time, but you never know exactly what the users are seeing. So as we launch this, as you begin to work with this, I would really, really appreciate any feedback in terms of how to make it easier, less confusing, more functional, et cetera, on and on and on, because this is going to be an ongoing program for us. So with that, unless there are other questions, Brian, it's back to you.
Well, I think that's what we had for you today, to try to get us all on the same page and to provide you with our intent from the Gold Ribbon Committee. And like I said, the biggest thing that I have is let us be a partner with you as you go through your documentation review and upload. And then when it comes to the visits, please know that that really what we're taking a look at is to really see the great work that you're doing, and to observe that as we go through, and also to learn from you, as well as also just to kind of have that opportunity. As I say, as we talk to more, I know that I learn more from all of your camps, and just from those conversations. So that's our intent. I thank you for being a part of this inaugural group. As we said, we'll be following up with information with regards to those resources that we have for you. Also with regards to this portal, please keep an eye open for when visitors are assigned and have that communication. And as you learn and go along the way, we appreciate your partnership as a member, and also in making this program the best it can be for our membership that will come after you. So with that, is there any other questions, comments?
Brian, thank you.
Well, thank you all for being here. You guys have a good rest of your day.
Thanks, Brian.
Thank you.
All right. Bye-bye.
Take care.
Are you going to stay on the line then?
Yeah, I'm on the line still.
Brian?
Yeah, I'm still here.
Okay.
I thought that went great.
Did it go okay for y'all? I think there's still got a couple people on here.
Okay. Did you want to cover anything else, Brian, or?
No. Do you guys have the list as far as what we want to follow up with folks? So we ought to send them to make sure that they get the standards.
Yes.
We have the resources. We're working on who their visitors are going to be, and then the portal when it's available. Correct?
Right. And if you want, I can make that welcome page on the portal, a link to all that other stuff, which might make it.
That would be. I think that would be user friendly if possible.
Yeah.
Yes. And can you send me all that stuff, and we'll work together in putting a greeting page together there.
Yeah, and actually, I will also send you guys the slide deck from this,
Great.
so we can send that to them as a resource as well.
Yeah.
Yeah.
I'll do an auto check on that first, though, an auto correct there, guy.
Yeah, I know. Oh my God, I'm reading through it going, what the heck did I do?
Yeah, autocorrect does wonders for people, so that's not a problem.
No,
okay, on the oversample study, you're all set for that? You're okay with that, the situation on that, Brian?
Yeah, I'm having a conversation with Lori here in about an hour, and so my goal out of that is to be able to make sure what she needs from us and to see if, in the process of moving forward. My guess is, I don't know, but my guess is that then we're just going to have to send links out to these camps. Or I don't know if they'll do that. I mean, in some ways, I would like it to come from COCA-I. I think it'd be a little bit more friendlier.
Yeah.
But yeah, so we can get this out to them and be a part of that. Yeah.
Yeah. Okay. Yeah. That time's a waste in it. things are coming up awfully fast. So if
And
they
all
need
one-
any information or a different format, Brian, please let me know. It won't take long at all to change that, so it's easy for them to work with.
Well, I thank you guys' support on this. I know it's kind of the launch and go. The next one will be our visitors.